We are now on our 11th session, and this session is about discussion on foreign body in the nose, deviated nasal septum, polyps, and trauma to the nose. Our goals are that at the end of the session, students will be able to list some signs and symptoms of nasal disorders, describe the management of nasal trauma, describe the surgical management involved, describe the pre- and post-operative preparations or management of patients with these conditions. Now, key topics to be covered in the session are definition, the incidence, causes, classification, signs and symptoms, and management. Our first topic is foreign body in the nose. And once again, you are being referred to do a review of the anatomy of the nose. Young children may push small objects up their noses, and foreign objects can block the nose and cause infection. Sharp objects may also damage the tissue and button, and batteries can cause burns and bleeding. But in all these cases, do not try to remove a foreign object as you may cause injury or push it further into the airway. And how do we know, or how are these foreign bodies recognized? So we come to the clinical manifestations. There's difficult or noisy breathing through the nose, swelling of the nose. There's a smelly blood-stained discharge indicating that an object may have been lodged for a while. Now we want to look at inhaled foreign objects. Small, smooth objects can slip past the protective mechanisms in the throat and enter the air passages leading to the lungs. Dry peanuts, which can swell up when in contact with body fluids, pose a particular danger in young children. And peanuts can also be inhaled into the lungs, resulting in serious damage. In addition, some individuals are allergic to nuts and may suffer anaphylactic shock after swallowing them. Manifestations, we mentioned some, but other manifestations of inhaled foreign bodies include persistent dry coughing, difficulty in breathing, and then signs of choking or noise of choking, which quickly passes. Techniques for removal. Several removal techniques are available, and for easily visualized non-spherical objects, most clinicians may prefer direct instrumentation. Direct instrumentation may be done, and by use of alligator forceps or bayonet forceps, as discussed in foreign body in the ear, the foreign body is removed. Friable and spherical foreign bodies are particularly difficult to remove with this technique, as they may tear, and the spherical ones may be difficult to grasp, and this may even result in posterior displacement. Hooked probes can also be used for objects that are easily visualized but difficult to grasp, and a flexible endoscope can also be used to visualize nasal foreign bodies and then used as a hook to pull out the object. And this technique is referred to as the hook scope technique, and it may be useful provided that the patient is extremely cooperative and the clinician is highly adept or experienced at flexible nasopharyngoscopy. Suctioning may also be done and is ideal for easily visualized and smooth or spherical foreign body. However, a strong seal is important for the success of this technique. And second topic is deviated nasal septum. The nasal septum is the bone and cartilage in the nose that separates the nasal cavity into the two nostrils. And then normally the septum lies centrally, and then the nasal passages are symmetrical. So in the picture, we have the nose and then the nasal septum. Again, you are being entreated to revise your anatomy and physiology. Then the septum is composed of structures as done in anatomy and physiology, so please revisit it. By a deviated nasal septum, by definition, is an abnormal condition in which the nasal septum is shifted from the midline to either the left or right. In the picture is a typical example of a deviated nasal septum. The first picture, as we can see, the septum is deviated. That is, it is curved instead of being straight. And the second picture shows us how a normal septum looks like or should look like. Incidence, it's estimated that 80% of most people unknowingly have some sort of misalignment to their nasal septum. Only the more severe imbalances cause significant breathing problems and require treatment. Causes may also include trauma, birth trauma due to compression of the nose, road traffic accident, assault, sports injury, developmental disproportionate growth, and then we may also have genetic connective disorders such as Marfan syndrome. Now we have various types of septal deviations. We have cartilaginous deviations in which the upper bony septum is central, but then there's a deviation of the cartilaginous septum and vault. And then we have the C deviation, where there's displacement of the bony septum to one side and the whole of the cartilaginous septum and vault to the opposite side. The S deviations have both the bony and cartilaginous septum in the form of an S, and this usually produces severe symptoms due to its severe nature. So the S deviation is the severest form of deviated nasal septum. Now the signs and symptoms. Signs and symptoms of deviated nasal septum include difficulty in breathing, infection of the sinuses, facial pain, sleep apnea, snoring, and hypertrophy of the inferior turbinates on opposite side of the deviation. There may be nosebleeds, post-nasal drip. There's sometimes external deformity of the nose, narrowed nasal cavity on the affected side with a wide cavity on the opposite side. And it may also result in mild to severe inability to smell. So in the picture we have an image showing external deformity of the nose. Diagnoses include physical examination, anterior rhinoscopy, inspection of the internal nasal structures with endoscope, and then CT scan of the paranasal sinuses as well as X-ray of the paranasal sinuses. Medical treatments include administration of decongestants, vasoconstrictors, example, ephedrine, otrivin, and ephedrine drops, and then xylomepha drops and spray. Then we have other steroid-based nasal drops such as hydroneo nasal drops, Avanese nasal spray, Betrisol nasal drops, and then we have antihistamines may also be given such as Piriton, Cetirizine, or Rizin. Surgical management includes submucous resection, obstructing nasal cartilage or the bone is removed after elevation of the underlying mucoperichondrial flaps on each side. And then artificial grafts such as plastic material may be placed in the space created to maintain the shape of the nose, but this may not happen in all cases. So in the picture, you are seeing the removal of the cartilage and the reshaping of the septum. Septoplasty may be done as a corrective surgical procedure done to straighten the septum. It's done under local anesthesia. It may also be done under general anesthesia, and a minor surgery can be said to be a minor surgery which lasts for 1 to 1.5 hours, and the surgeon works through the nostril, making an incision in the lining of the septum to reach the cartilage targeted in the operation. Then after the septum is straightened, it may be stabilized temporarily with small plastic tubes, splints or sutures internally, and packed to maintain its shape. So that is the operation in progress. The picture shows the patient with nasal septum before and after surgery. And pre-operative management includes psychological preparation. Again, I'm entreating you to go back to general pre- and post-op management of patients, informing patients about the benefits of surgery and the associated complications, introducing patients to other patients, and giving patients opportunity to ask questions. We also talk about fasting 6 to 8 hours before surgery, especially if it's going to be general anesthesia. Patient is restricted from taking medications containing aspirin at least 5 to 7 days before surgery. And then if patient smokes, he or she is advised to stop smoking. Then, under physiological care, ensure diagnostic investigations such as full blood counts, clotting profile, chest X-ray, to mention a few, are done and duly filed. And pre-operative, as part of the pre-operative preparation, physical preparation. Under physical preparation, dentures, rings, chairs, or any metal objects on the patient's body are removed, and the patient is done a theater gown, and identification or wristband is placed on the wrist. Post-operatively, the head of the bed is elevated to about 30 to 45 degrees to reduce swelling of the operated site, and analgesics are administered as prescribed, as well as antibiotics. The site is observed for bleeding. However, a small amount of bleeding may be expected during the first 24 hours, and it may last for 10 minutes. If bleeding is prolonged and it is also profuse, it should be reported to the surgeon. So bleeding which lasts for more than 10 minutes should be reported to the surgeon. The bright red bleeding which lasts for more than 10 minutes, I repeat, should be reported to the surgeon. Patient is encouraged to start liquid diet immediately, and if the condition and then it progresses according to the patient's condition, or it progresses gradually to normal diet if liquids are tolerated, and if condition stabilizes within 48 hours, he or she is allowed to go home to return on a scheduled date, usually 3 to 4 days, for removal of the nasal packs. Patient is informed about nasal congestion, and decongestants are administered to reduce congestion. 2 to 3 days post-operatively, patient comes back or is rescheduled for cleaning and examination of the nose. Post-operative instructions are given. Patient is instructed to avoid blowing the nose and not to engage in any strenuous activity, not to take non-steroidal anti-inflammatory medications such as aspirin, limit alcohol beverages, and avoid cigarette smoking. And post-op complications may include bleeding, nose infection, hole in septum, external deformity of the nose or a change in the shape of the nose, loss of the ability to smell, pharyngitis, laryngitis, and tonsillitis. Our next topic, which is topic 3, is nasal polyps. So in the picture we have polyps occupying the patient's nasal cavity. A polyp is shaped like a teardrop when it's developing and resembles a peeled grape when it matures. It usually develops in areas where the sinus opens into the nasal cavity and may block drainage from the sinus. Fluid may accumulate in the blocked sinus, causing a sinus infection. They are the out portion of mucous membrane lining the nose or the paranasal sinuses, and they commonly arise from the ethmoid sinus and hang in the nasal cavity, causing nasal obstruction. It can also affect the antrum and the turbinates, and can also become, therefore the antrum and the turbinates can also become polypoidal, and most are associated with allergy. We have the antrochoanal. It arises from the maxillary sinus. It is single, unilateral, and is less common. Then we have the ethmoidal one, which is multiple, bilateral, and more common. Causes include allergic rhinitis, nasal infections, tumors, and cystic fibrosis. The manifestations include nasal obstruction, mouth breathing, runny nose, congested sound, sinusitis, anosmia, as in loss or absence of smell, headache, and difficulty in breathing. The following investigations may be done: X-ray of the nose, physical examination, and biopsy to detect nasal polyps. Management can be medical or surgical. Usually, the medical management is symptomatic and is done by treating the underlying cause. Some medications given are analgesics, antibiotics, and nasal decongestants. And surgery may also be needed in most patients to remove the nasal polyp in order to restore nasal breathing. It can be done through polypectomy, that is performed using local anesthesia. And after the polypectomy, it involves a snail-like instrument used to excise or incise the polyp, and bleeding, which is associated, is cauterized or arrested, and intranasal packing is inserted, after which a functional endoscopy is done. So functional endoscopy, sinus surgery may also be done. Specific pre-operative care reinforce all explanations or teachings done by the surgeon, teach mouth breathing exercise, and then inform clients of the presence of nasal pack post-operatively. Is also explained to the client the importance and rationale for assuming a semi-fowler's position, and client is told to avoid blowing the nose. The area around the nose is cleaned, the nostril is swabbed with normal saline, and client is encouraged to have bed rest and avoid poking or provoking bleeding. And specific post-op care include maintenance of client's airway. Then the mouth is felt for breathing. Mouth breathing is usually for 24 to 48 hours. And then frequent mouthwash is done, and fluid intake is increased. And then patient is encouraged to lie in the semi to fowler's position to promote drainage and minimize edema by elevating the head end of the bed. Continuous ice compress is done, especially for first 48 hours to decrease edema. And then vital signs are monitoring and any deviations reported. The oropharynx is also inspected for presence of blood. Frequent swallowing is observed, and this indicates bleeding. Patient is also advised to avoid forceful blowing of the nose, and nasal packs are maintained for 24 to 48 hours. And when the packs are removed, the bridge of the nose is compressed against the septum for 5 to 10 minutes to help prevent bleeding. In anterior nosebleeds, the area may be treated with silver nitrates and gel foam or by electrocautery, and topical vasoconstrictors such as adrenaline may also be prescribed. And if bleeding is occurring from the posterior regions, cotton soaked in vasoconstricting solutions may also be inserted into the nose to reduce blood flow and improve easy viewing of the bleeding sites. Encourage patient not to swallow the blood, but spit it out. And then prescribed medications such as antihistamine and analgesics are administered. Mouth care is done frequently, and cold foods are initially served. This will help constrict blood vessels and then prevent bleeding. And preventive measures include avoidance of exposure to allergens. That is, exposure to allergens should be minimized. All nasal infections should be treated, and abuse of nasal sprays and drops should be discouraged. Our next topic is trauma to the nose. Nasal trauma is defined as any injury to the nose or related structure that may result in bleeding and a physical deformity, or it may also result in decreased ability to breathe normally because of obstruction or an impaired sense of smell. The injury may either be internal or external. So in the picture, we have a patient with nasal trauma. Etiology, it may be accidental, as in transportation accidents or road traffic accidents, sports injuries, animal bites, gun injuries. Then it may also be intentional, fights, criminal assault, domestic violence, nose piercing. Then in athletic activities, bodies of other players, hitting against people. Nasal injuries may also occur from piercing jewelry. Internal injuries may be either mechanical, which are caused by foreign objects, or we may also have chemical injuries to the nose, which may be caused by accidental or purposeful breathing or sniffing of irritating substances. Their symptoms include flattening or other deformation of the shape of the nose. We may have epistaxis or bleeding from the nose. There may be crepitus or a crackling sound may be heard when the end of the fractured bone rubs against each other. There's pain and tissue swelling, airway blockage from bleeding, fluid discharge or tissue swelling. There may be rhinitis, and rhinitis is an inflammation of the mucous membrane lining the nose. Septal hematoma may be present, bruising or discoloration, and leakage of cerebrospinal fluid through the nostrils. The patient may have watery eyes and runny nose. There's pain, loss of sense of smell, nasal congestion and sneezing, reddening and swelling of the mucous membrane, and then eventual destruction of the cartilage in the nasal septum and the tissues lining the nose. The diagnostic investigations include CT scan, X-ray, MRI scan, and a chest X-ray as well as a pulmonary function test may be ordered to determine if there's any subsequent lower respiratory tract involvement. So the treatment. Foreign bodies in the nose can be removed through suctioning in most cases. And treatment of nasal fractures depend on the extent of the injury. Any fracture should be reduced either under local anesthesia. However, in younger children, these injuries are treated under general anesthesia, but in adults and older teenagers, it may be treated under local anesthesia. And reduction of nasal fractures may either be open or closed. So rhinoplasty, that is a plastic surgery of the nose, may be done to repair or change the shape of the nose. Pre-operatively, if there is to be a local preparation of the area, for example, nasal packing or Moffat's method, the procedure is explained to the patient and ensure that the patient is aware of the possibility of nasal packs or splinting being inserted in the operating theater. Appropriate length of time that the packs are going to be there are also indicated, and ensure that patient is also told the likelihood of post-operative nasal obstruction. And then the nasal airway, patient should be told that it may be swollen for varying length of time after the surgery, and full resolution may take up to 6 weeks. So patient teaching is important post-operatively. And post-operatively, the patient is told to assume a position which will aid drainage, prevent problems that occur from the presence of anterior and posterior nasal plaque, such as hypoxia. And then measures that help reduce nasal obstruction are applied, and patient is assessed, and then prevention of facial edema is prevented. Then patient is taught how to care for any prosthesis that may be inserted. The nose is a vital organ for exchange of gases, and foreign body or trauma of the nose can have a life-threatening consequence, and therefore nasal polyps can also bleed severely, and patients with nasal problem should be managed with urgency and care. For your references, you are being referred to read the following books for further information. Thank you.